Welcome to Knights of the Blind, a new TV show designed to give you an opportunity to meet some of the people in Oregon that make it such a special place to live. You know, in Oregon we have some wonderful organizations and businesses such as Nike, Columbia Sportswear, Bob's Red Mill, Reese's Fine Foods that make our state a wonderful place to live. There's also some wonderful nonprofits that not only make the state more livable, but have a significant impact on the people that call Oregon their home. One organization is the Oregon Lions Sight and Hearing Foundation. And Lions Club members throughout the state comprise a group of people that make a significant impact by being Knights of the Blind. Tonight, we have two guests from the Oregon Lions Sight and Hearing Foundation. I'd like to introduce you to the Associate Director of the Oregon Lions Sight and Hearing Foundation, Brenda Anderson.
Thank you.
And the Director of Programs at the Oregon Lions Sight and Hearing Foundation, Kerith Vance.
Hi.
Thanks for being here.
Thank you.
So Brenda, I'll start with you.
Okay.
Give us a little bit of an idea of, for those of us that don't know, about Lions Clubs, Lions, and their connection to Helen Keller.
Well, Lions Clubs were founded in 1917 when Melvin Jones, who was a businessman in his area, wanted to create a volunteer outlet for people in his community, and they wanted to provide some service. They developed pretty quickly, and in 1925 they invited Helen Keller to visit one of their conventions. And when she was there, she gave a speech challenging the Lions to become the Knights of the Blind, to help eliminate preventable blindness and hearing loss in the world, and they took up that cause. And that's how she kind of became our inspiration and our mentor.
Wow, so back in 1925,
Correct.
the Helen Keller attended a meeting of the Lions and asked the Lions to take up her cause.
They did.
So for what, almost 90 years now, Lions have fulfilled that promise. And Kerith, can you give us just kind of an overview of some of the ways that the Oregon Lions Sight and Hearing Foundation keep this promise to Helen Keller?
Sure. So our foundation office has several different ways that we can help people with vision and hearing related issues, such as surgical procedures, hearing aids, eyeglasses, and also health screenings that are done on people of all ages throughout the state.
Wow, that's amazing. So I will tell you that a few weeks ago, I was at Legacy Good Samaritan Hospital, and there were, I think, 13 or 14 Oregonians that were receiving cataract surgery for free.
That's right.
Was this a program because of this promise to Helen Keller?
It was that promise that she asked people to keep and help the Knights of the Blind, that Devers and Legacy have partnered with the Oregon Lions Foundation to provide donated surgeries for individuals that need help with their cataracts.
Okay, so as significant as a surgery that gives somebody the opportunity to see where they would otherwise go blind, and I think you also mentioned some hearing programs. We'll get to that in a minute or two. I'm fascinated by the fact that Lions are part of a network that provides screening in schools for sight and hearing. And because I have to admit, when I was a little kid and I had my sight screened, I don't remember any Lions. I remember a school nurse, and I remember teachers doing it. But why don't you tell us a little bit about this mobile health screening program that Lions are involved in?
Absolutely. Back in 1994, we realized that there was a real need in the state of Oregon. Several Lions leaders had gone and visited one of the conventions, and they saw what Lions were doing in other states, and so they thought, we're going to bring that back here. We really want to create a program that reaches all corners of the state, that we're able to provide screenings for students and community members, and in particular the need among schools was great. As our number of school nurses has gone down over the past several years, and the need of the students has increased, we've really tried to meet the need and provide the sight and hearing screenings. We started initially with just a few thousand, and it's grown since then. Last year we were able to screen over 48,000 students.
Wow.
in Oregon, in Northern California.
So Brenda, when you say that schools are not able to meet the need, are you suggesting that some school districts have cut screenings from their budgets, or do some schools not do the screenings?
It's not so much that, it is that it's a more complicated process. When you want to do it really, really well, you go in, and what you might have experienced when you were growing up is kind of a chart screening. You go up and you do a distance visual acuity with the chart.
I cheated, by the way, when I was a kid on my vision screening.
Please don't do that. No, that's really important for us to do a really quality screening. And we're not only checking for how well the child can see distance vision, but we're looking at how well they can see close up, whether there's other issues. There can be alignment issues with the eyes, or how well the eyes work together. And in particular, we're really trying to identify younger students who might have a condition called amblyopia. That particular condition, if not discovered and corrected in a real timely fashion, usually by the time a child is 8, they may experience permanent vision loss.
So I remember when I was a kid, one of my brothers had a patch on his eye, but I never knew why he had the patch. Tell us a little bit about, is that the amblyopia that you're talking about?
That's one of the conditions that they're looking for, and that's one of the ways that they can treat it. There are several different ways that they work with the child. They can do different therapies, they can do patching therapy, and then sometimes, depending on the type of condition, they may have additional procedures and treatments that they can apply.
So, and again, thanks for helping me understand. If a child has amblyopia, but the family doesn't know it, and if it's not caught during one of these screening events, what can happen to that child?
Vision loss can be permanent. So essentially, as the child is growing, the nerves that go from the eye to the brain and how the brain interprets those signals is affected by that misalignment. They're not able to process that information, and once those things are more permanently set as we grow, that's not something that can be overcome. Once it's done, and that's a permanent vision loss, and it can actually be full blindness.
Wow. Well, that's a great service, and it's a great example of being Knights of the Blind.
Absolutely.
Because lines that are preventing young people, it sounds like thousands of young people from becoming blind due to something that's very simple to fix.
Absolutely. We have a variety of ways that we go in and we screen and test for those types of conditions. Not only are we doing, say, a distance visual acuity with charts, but we've got cards that we can look at to test the bilateral vision and how well the eyes are working together. And then we have new forms of technology, which I'll just grab right here. This particular device is something that we use to take basically a photograph of the child's eye, and it gets held up like this, and it's a very, very quick process. Once it processes the information inside, we can get an immediate objective result as to whether or not the child has a condition that we need to send them to the doctor for.
So I think on a future episode of Knights of the Blind, we may invite this back for a full show.
Hope so.
Because they were showing me this before we went on air. This is a handheld computerized camera that the volunteer screener basically takes a snapshot of the child's eye, and instantly it can be identified if the child is nearsighted, farsighted, if they have amblyopia or lazy eye. We can find out exactly what their prescription is, and then the eye doctor, once the kid is referred, can know exactly where the starting point or the baseline is with that child. This is state-of-the-art technology.
It is.
The Oregon Lions Sight and Hearing Foundation now has 20 of these,
We do.
I understand, spread around the state
Absolutely.
and saving the sight of young people. Since we're here in Beaverton, tell us a little bit about the Beaverton School District and your partnership with Beaverton.
Certainly. Well, last year we had made some significant changes to our program and developed what we call kits. And those kits are what we took equipment into the schools. It was our first year working with Beaverton School District, which, as I understand it, is the second largest district in Oregon. And we went in and we were able to provide screenings for almost 12,000 students in Beaverton. We worked very closely with the school nurses, and one key nurse in particular, Kim Bartholomew, worked with us to make sure that we were getting into the schools, that we had the resources and the volunteers that we needed. And we worked with dozens of community volunteers and Beaverton Lions Club members who came out and helped us to coordinate the screenings. We did this at the same time we were with other large school districts. We were out in Tiger-Tualatin School District, we were also in Oregon City, and we were in Klamath Falls and all across the state. So we kind of put all this and implemented it. That's how we got those kids screened. This year when we go out, we're going to be setting up the same thing again, but we're going to be able to use these devices. And our hope is that with the objective measure, working with the volunteers, it's going to be a little bit easier for us to make sure to document those referrals and then get a really comprehensive report home to the parents so that they can take their kids in for that exam they may need.
Wow, that's really impressive technology, and I appreciate you taking the time to share it with us.
Sure.
Kerith, let's move on to you and give you an opportunity to tell us a little bit about the surgeries that you mentioned. If I understand it, there's a program, your patient services programs. Tell us a little bit about the surgery, the treatment, and how people benefit from that program.
So our Lions Clubs from around the state connect with individuals who maybe they've got a cataract developing in their eye, or they've got glaucoma. In some cases, they've got long-term retinal issues that need either a surgical treatment or ongoing treatments such as injections of different medications to help keep their vision from being lost to blindness. And all of those different conditions are treatable if they're caught and they're able to get to a doctor and have the surgery done. So what we do is facilitate individuals who either don't have any insurance at all or who are lacking enough insurance to go get that help. And we have doctors that we partner with throughout the state that are willing to, at vast discounts or even donated services, help individuals that the Lions Clubs have referred to be able to get treated and to be able to save their vision, and in some cases even their hearing, depending on what kind of surgery they need.
So it's really amazing, if I understand it correctly, and amazingly sometimes I don't, that you have a network of healthcare providers around Oregon that include audiologists and optometrists, ophthalmologists, that work with the local Lions Clubs and work with your organization to help people in need. So the Knights of the Blind that we refer to isn't just you two, it's the Lions Clubs, and there's 178 of them, I think, in Oregon, and the other critical component are the healthcare providers themselves. So if I understand it right, there are hundreds of eye doctors. In fact, we've got a great image that's up on the screen right now. These pinpoints that you see that's where the Lions Clubs are located in Oregon. I mean, they're pretty much everywhere. There's, again, about 178 Lions Clubs. There are some clubs that have as few as 10 or 15 active members. There are some Lions Clubs that have 100, 120 active members, I understand. And these are the Knights of the Blind, and it's the army of volunteers that are out there helping you identify, who needs a hearing aid or who needs surgery. So to talk a little bit more about the surgeries and these providers, I mean, who are some of these surgeons that are providing? Isn't there a Dr. Baelish that's here in the Beaverton area? Can you tell us a little bit about?
There is. He works with Oregon eye specialists, and he does a lot of cataract surgeries, and he actually is one of our mission cataract providers. He actually donates about 9 surgeries every year for free to people in the community that otherwise would not be able to access their surgeries.
So, I think a lot of people, of course, have heard of cataract surgeries, but maybe not everybody realizes, and this is something I recently learned, is that if we live long enough, we will develop a cataract. It's not some kind of a disease that strikes 1 in 100 or something like that. It's a reality of life. If we're lucky enough to live long enough, we will get a cataract. But the reality is that these surgeries are not cheap, and a lot of us don't have, especially those that are aging and are on a fixed income, can't necessarily afford cataract surgery. I think I know that cataract surgery, the cost might vary from facility to facility, but do you have a ballpark figure of what, either one of you, what it might cost for out of pocket for a cataract surgery?
Depending on the person's coverage, it can be between $3,000 and $7,000 per eye to have a cataract removed or have one of the intraocular lenses placed.
Okay, so again, there are probably, I'm going to go out on a limb and suggest that there are probably a lot of people on a fixed income that can't afford just to pay that $3,000 to $7,000 for a cat, and so their choice is to go blind. So again, this is where the Knights of the Blind come in.
Exactly.
So we've mentioned Dr. Martin Baelish. I understand there's 25 or so surgeons that actually donate an entire day of cataract surgery. How do people get selected and approved to benefit from this cataract surgery program?
So for individuals to qualify for the program, they can contact our office and we can help connect them with their local club and get them an application process. It's a fairly straightforward process to fill out. It's a quick application form, and then they work with their local club to gather that information, and we have a look at it and check their medical notes just to make sure that they're really ready for that surgery. And then with the Lions Clubs, we help get them to a provider that can meet that need and provide that surgery, and then get them the aftercare that they'll need as well.
Okay, and I know that later on during the show we're going to put a number. Oh, in fact, the number's up there right now. A number that can be called if you know of somebody that needs help, not only with cataract surgery, but with a hearing aid, with eyeglasses. We're going to talk about that here in just a minute. There's a number that can be called. There's an email address that can be utilized, and there's also a website. Any one of these 3 ways can be utilized to let you know if somebody needs some help. So we've talked a little bit about the cataract surgeries. Brenda, let's go back to you. And eyeglasses, huge need.
Absolutely.
People need eyeglasses to work, to drive, to raise their kids, and they're not cheap. It's not cheap. The the last time that I went and bought eyeglasses, well, it was a long time ago because it's just not something that I work into my budget. So you have a program, the LEAP program. Can you tell us a little bit about that program?
Certainly. We now work with Vision Service Plan, which is the nation's largest nonprofit vision insurance provider, and Prevent Blindness America, which is one of the nation's, they kind of work on policy and training for people who do vision screening. But they also are very interested in working with organizations like ours, and they've developed what's known as the Mobilize program. We access those gift certificates and we distribute them through our Lions Eyeglass Assistance Program, the LEAP program, through the Oregon Lions Sight and Hearing Foundation. And so far, since we started running this program and distributing those gift certificates, and January 22nd was our first day of doing so, since then we've distributed over 2,500 of those certificates here in Oregon.
Wow, let's pause and make sure that that I heard that right. So since January,
Yes.
and we're in late July, early August or so, right about now. We're in the end of summer. In about 7 months, 8 months time, did I hear you right that you have provided 2,300 gift certificates for eye exams and eyeglasses?
Over 2,500.
Over 25. Wow, see,
Yes.
I didn't hear it correctly.
Yeah.
20. That's amazing.
It is.
And these are people that live where?
They're throughout the state. And actually, they are some in communities very near to us. We also serve Northern California, and we've helped provide access to areas from other states who want to access this program as well. But with those people that we're helping, they are all across the state, and there are providers that work with us through Vision Service Plan in order to provide the care. And people with the gift certificate get an exam and a pair of eyeglasses. And the eyeglasses can be either single vision, double or bifocals, trifocals, lined, and those are some of the options. There are some limitations as to the type of frames, but most of the people that qualify are living at less than 200% of the poverty level. And we verify them, their income. We work with our sight and hearing chairs, which are volunteers with each individual Lions Club that help people access these programs. And once we get those together and get the gift certificates out, we help them, or those sight and hearing chairs help them set up their appointments and get there.
Yeah, this is wonderful to hear, and congratulations on helping so many people in such a short period of time.
Thank you.
You've mentioned sight and hearing chairs,
Yes.
and I'm going to ask Kerith to tell us a little bit about that. Are these the individual volunteers at the Lions Clubs that work with you?
They are. So every one of those 178 Lion Clubs throughout the state has an individual, or maybe even 2 or 3 individuals in their club that put in a lot of hours and a lot of time directly working with our programs. So they help connect the people in their local communities, whether they're kids or the elderly or people that are trying to get back to work, with our programs by helping them with their application process and just making sure that they know what's out there, what the people can get help with. And then they help them with the process once they've been approved of actually being able to go and get to where they need to go and get those services taken care of.
So, you know, a new pair of eyeglasses, just conservatively, you get an exam, of course, and you get your frames and lenses. You know, they're not cheap. We'll say maybe $200, $250.
At least.
At the low end,
Yeah,
yes.
and yet you have provided help for 2,500 people. If you're better at math than I am, you would come up with a number closer to my approximation of, I don't know, what is the math? 2,500 times about $200 or so. That's getting close to $500,000.
It's getting up and over, yeah.
In healthcare, vision healthcare, that these Lions Clubs are providing to people in need. They are Knights of the Blind. It's very, very impressive. And that's just the eyeglasses.
That's just eyeglasses, yes.
And there's a hearing aid program that's very similar to your LEAP program, right?
Correct.
And what do you call the hearing aid program?
We call it ROAR. So our newest program that we have at the for the foundation that Lions have access to is called ROAR, and it's a fantastic program. It allows individuals throughout the community to have access to a hearing test, and if they need it, they can get 1 or 2 brand new digital aids to just and follow-up appointments to be able to use them. And it really, that's something that beyond, eyeglasses are expensive enough and out of reach, but for so many individuals, when their hearing starts to go, they just don't realize that there's any option out there, and it's just something that's at $3,000 to $6,000 to get a hearing aid. People just cannot access.
Right. So this program I actually know a little bit about, because a very good friend of mine is Jeff with All American Hearing Centers, and I understand that this ROAR program is made possible by your friends at All American Hearing.
That's correct.
And there are locations throughout the state. There's no catch to it. They are just providing free hearing exams and free brand new hearing aids for those that need help.
Correct. Qualified through our foundation, and we take a look at the full application, make sure that they meet those qualifications, and then the sight and hearing chair and our office work together to get them set up and get their appointments.
Okay, so you're helping people that are truly in need.
Absolutely.
And those that are interested in finding out, gosh, how can I become a Lion, or how can I get involved with the Oregon Lions Sight and Hearing Center? What are the criteria? Can go ahead and again contact Kerith and Brenda at the number that you see on the screen, and the email address, and the website. So in terms of the specifics of what that criteria is, we won't get into it today, but let's just, is it fair to assume that these are people that are maybe at or around the poverty level, and they have to document that they're in need?
We actually provide services for people that are living at or below 200% of the federal poverty level.
Okay.
And that counts their whole household. So, and basically, and that they're living here in Oregon, so that they're actual Oregon residents, and that's really the basic qualification.
Okay, great. So it was kind of fun to hear off air, before we came on air, a story that you mentioned of a gentleman that you saw at the Vancouver Farmers Market.
Correct.
Dionysius?
Dionysius.
Tell us just a little bit about Dionysius.
Well, Dionysius found out that he had a cataract, and he knew he didn't have the resources to take care of it. He found out through his doctor's office that was providing the initial exam, about our organization, and he put in an application. We were able to get him assistance through one of the patient care days, I believe it was, with Dr. Martin Baelish at Oregon Eye Specialists. And when he went in, he was able to get that cataract taken care of. He got an intraocular lens put in, and he was able to recover his sight. And he's a very vibrant personality, and he goes, and every weekend at the Vancouver Washington Farmers Market, he plays piano, and he's got his keyboard out there and does an amazing job, and he's just really neat guy. So if you ever see him.
So without the surgery, his ability to be an entertainer and perhaps make a living would be compromised, I'm sure.
Absolutely.
And I'm not sure I think we might have an image.
I think it was up, yes.
But maybe we don't of the surgeries. So we have enough time to talk a little bit more about Lions clubs themselves. Oh, great.
Yes.
So I believe the gentleman on the viewer's left that is being very grateful to his surgeon is your man Dionysius.
That is him.
Great. And so his surgery took place,
I want to say a little over a year ago.
Okay. And the location of that surgery, I'm sorry.
I believe it was Eye Health Northwest.
You could be correct on that one.
So another one of your partners, we mentioned Dr. Martin Baelish earlier, and then you have a group of surgeons from Eye Health Northwest that provide a significant number of your cataract surgeries. And we mentioned, from the eyeglass standpoint, your friends at Vision Service Plan and Prevent Blindness America that make the LEAP program happen.
Correct.
And the hearing aids are courtesy of All American Hearing Centers, which is just, it's like a list of Knights of the Blind and providers. It sounds like we could go on and on and on about. What I want to get back to is, again, as we're coming to a close in the next couple of minutes, is to hear a little bit more about Lions clubs themselves. We mentioned briefly the Beaverton Lions Club. I know that there's also a Cedar Hills Sunset Lions Club in this neck of the woods. But we saw the map. There's clubs all over the state. For somebody that might be interested in getting involved and joining a Lions Club, what do Lions Clubs do other than being Knights of the Blind?
Well, they have a real dedication to volunteer and service in their community. Their motto is "We serve," and so their goal is to find what really can they influence for youth, for people living in businesses, working in their communities, what they can do to improve their vision, prevent hearing loss, and they're very interested in programs that relate to that. And so they do work very closely with us as a foundation, and then they also work in their communities depending on what's available, and they partner with a lot of other organizations. And so they support whoever's kind of doing that work in their community and try and find those relationships with providers.
Now, I do know, because a good friend of mine, Brad King, is a Lion, He's a member of the Tualatin Lions Club. And isn't his dad Phil a Beaverton Lion right here in Beaverton?
That's
I believe?
correct. Yes.
Yep.
Now, he's got some kind of beer garden Oktoberfest thing planned coming up here pretty soon. So Lions also have some fun.
Yeah, oh yes.
Do they not?
Yes,
Oh,
they
they
do.
Don't they have different festivals and events? And can you talk just a little bit about that? I mean, I know that if you're down in Elkton, in the southern part of the state, they have a pig roast and raise money to help you become Knights of the Blind. In Bend, there's a demolition derby. But these Lions, they actually have fun too.
Absolutely. They're attending fairs and festivals. They go out into their community. They develop events that are really fun for community members to come and attend. They also work with others to get out there. So yeah, we have a lot of fun.
And do I understand correctly, there's a new Lions Club that's being formed in the area of your offices in Northwest Portland, the Legacy Lions Club, and that's going to be named that after Legacy Good Samaritan, I believe. And there's a relationship there also between Good Samaritan Hospital and your Oregon Lions Sight and Hearing Foundation.
There sure is, yes.
And can you give me just a little bit of an overview? How far back does that go?
Well, we've been working with Legacy and in particular Devers Memorial Eye Clinic for years, since we were founded essentially. We had a medical director, Dr. Richard Chenoweth, who helped to oversee and found our organization. And his offices, the foundation was run out of his offices for a number of years. And then in the mid-'80s, Legacy Good Samaritan was trying to create a new building. And Lions Clubs went out and they did a significant amount of fundraising in order to help them out with that. And so our offices are connected to them. We work very closely with Legacy. We're able to partner on it, not only with our mobile health screening, they help to support that program, but also through our Mission Cataract and providing surgeries.
Wow, that's that's great to hear. And something that was told to me recently is that this partnership that the Oregon Lions Sight and Hearing Foundation has with Legacy Good Samaritan includes the fact that your office space is free to you.
Correct.
So when I pull out my checkbook and write a check to your organization, none of it goes and pays your overhead or your occupancy. All of it, in fact, goes to help people.
That is correct.
It's really fantastic. So for those that want to be Knights of the Blind, this is a great organization to support. For those that maybe are interested in becoming a Lion, again, you've seen a phone number and an email address that's up on the screen. Give us a call. Send us an email. Find out how you can be a Lion, how you can be a Knight of the Blind. And we look forward to seeing you next time. Thanks for being here today. And thanks for joining us on Knights of the Blind. Thanks, Brenda. Thanks, Kerith.
Thank you
Thanks,
very
Doug.
much.